Good morning, everyone. My name is Tim Paul and I'm the Chief Executive of the Carer Support Centre. And it's my privilege today to welcome you all to the Carers Week open meeting. I have to admit, I've got mixed feelings, I suppose, when it comes to Carers Week. On the one hand, it's great there's a week of national promotion of carers, the challenges you face, etc. However, in my book, there are another 51 weeks in the year when carers are often forgotten, unrecognised and unsupported. And our challenge, all of us together and our partners, is to make every week Carers Week. But until then, what we'll do is we'll take advantage of this and other national weeks and days to promote and recognise and celebrate all the carers, all that you do and the incredible contribution that you make to the society we live in. And reflecting back on last year's meeting, who would have thought just over a year ago when we last held the open meeting that over a year on, we'd still be having to hold meetings like this virtually. It's certainly been a year to contend with, and carers have borne the brunt of that. And we'll be exploring that and the impact of that a little later on this morning. It's also been a very challenging year for the Carer Support Centre. Notwithstanding a number of internal changes that we've gone through in the last 12 months, we've also had to completely adapt our ways of working to take account of the pandemic, whilst at the same time prioritising the health, safety and well-being of our staff and through them, the carers that we support. We haven't always got that right and we've fallen over a few times, but that's not been through the lack of any trying. And I think overall, with a few exceptions, we've managed to continue to provide all of our services in one way or another, as well as introducing some new ones and some new ways of actually doing things. And I'd just very briefly like to publicly thank our staff and volunteer team here for their unwavering flexibility and support and commitment that's seen us through the last year and hopefully towards the end of this pandemic. I'd also like to thank our core partners and funders from the statutory sector, Bristol City Council, South Gloucestershire County Council, and the snappily named Bristol North Somerset South Gloucestershire Clinical Commissioning Group. I always find that one a bit of a mouthful, but you know, we'd like to thank all of those for their ongoing support, not just financially, but standing by us and many other voluntary sector organisations during what's been a difficult time for all of us. And I think what's been really pleasing for me, and those who've heard me sort of in meetings will get bored of me to continue saying this, but we've seen some really good partnership working and people actually getting rid of the barriers and getting out of the way and just focusing on we need to get things done. And it's amazing that we've achieved so much together across the whole of Bristol and South Gloucestershire. And you know, we've been able to do that being less risk averse and actually less bureaucratic and making decisions because we've had to move quickly. And again, the challenge for all of us is to continue to do that in whatever the new norm continues to be, because it's a much more fun way of working. And actually as well, I think, you know, as we've seen, it allows you to achieve a lot more and a lot more quickly. Needless to say as well, we've learned a huge amount during the last 12 months, not only about how we can adapt our services, but importantly, how you carers want us to adapt them. And you know, that was one of the lessons we had, that actually some of the things that we changed perhaps a bit more digitally, digital provision of services, etc. A number of carers were really pleased about that and don't want us to go back to not providing services in that way. So moving forward, we, like lots of other organisations, are taking lessons from the last 12 months into an organisational review, from which I would anticipate us probably moving to a more blended model of delivery. And the challenge for us is to ensure that we retain the successes and the new ways of working that we've developed throughout the pandemic, whilst at the same time not throwing out the baby with the bathwater, so to speak, and ensure that, you know, those carers that perhaps can't access services in some of the more digital ways still have access to us in the ways that they always have. There will be more of that over the coming months. As I say, we're looking at a complete organisational review to look at what the changes that will be brought into Carer Support Centre, both in terms of service provision and sort of flexible staff arrangements to enable us to do that. Before introducing our speakers, I'm pleased to be able to say that as a result of the generosity of an organisation, the charity 3H that we do work with, we've been given 4 hampers for a prize draw. So what we'll be doing is later on in the meeting, we'll be randomly drawing out details from a digital hat, and the 4 winners, the 4 lucky winners, will arrange to receive the hampers when they're available in July. So hopefully 4 of you will have an even bigger benefit from coming today than just hearing the interesting things that our speakers have got to say. And talking of speakers, I'm delighted today that we've got 4 excellent people looking at different aspects of the impact of the pandemic, and what that's had on carers and their lives. I think importantly, very importantly for me, how we move forward from that, and what are we taking from it, and what do we need to keep and make sure as we all move into the new normality. We will be welcoming Ramzi Suleiman, who is the Policy and External Affairs Officer from Carers Trust. And Carers Trust is the national organisation that supports carers across the country through a network of partners like ourselves, providing very similar services to us, as well as domiciliary care, etc. And Ramzi will be sharing thoughts on a number of areas with us about the impact of the pandemic on young and young adult carers. But we'll also be touching on the adult social care reform that's going through at the moment, and the health and care white paper. And there will be opportunities for you to feed your thoughts into that later on, that then Ramzi can take back into national consultations. So that's a really positive move for us there. A more familiar but nonetheless welcome guest is Sonia Davis. Sonia will be well known to many of you as the Strategic Commissioning Manager with Bristol City Council. And Sonia is going to be sharing the results of a recent survey of older carers and the impact the pandemic's had on them, and similarly as the lessons learned. And we're also pleased to welcome, I think for the first time to one of these, Emma Temple, who's the Commission Officer for South Gloucestershire. And similarly, South Gloucestershire undertook a carer survey during the pandemic, and Emma will be sharing their findings and thoughts and the actions that will be taken from that. And last but not least, one of our very own from Carer Support Centre, Judy Goenlock, who's our health team training and development worker. Judy will be sharing some of her team's work supporting carers whose loved ones are in hospital. So look forward to hearing all about that. I hope, and I'm sure you'll find all the presentations informative and interesting, and that they stimulate thoughts for the discussion groups that follow the break. And I think that's really an important part of this session, is actually getting your thoughts and your views back. And as I said earlier, whilst it's really important that we review the impact of the pandemic and how that's affected the lives of carers, it is really important that we ensure that that focus on carers and other community support that's been there because of the pandemic, as that wanes, as the pandemic begins to ease, we've got to make sure that there are still things in place that ensure carers continue to get supported as we move into what will be the new normality for all of us. And talking of normality, I'm hoping, he says fingers crossed, but I thought the same last year, I'm hoping that this time next year, we'll be meeting in person, face to face, as well as having the facility for those who can't physically get to a meeting to join us virtually and still play a full part. So I look forward to the day when we can get to that sort of stage and ensure that even more people can engage in events like this. I'd now like to hand over to a new member of staff who I know some of you have already met, Susie Jalari, who recently joined the Carer Support Centre as our Carers Policy Engagement and Involvement Lead. And Susie will be working with many of you over the coming months as we shape the support we provide to ensure that carers not only have a voice, but have the opportunities to use it, and importantly to influence policy making and service planning on services as they relate to carers. Today though, Susie will be facilitating the meeting, so a warm welcome to Susie for her first Carer Support Centre event, and over to you.
Thank you, Tim. Yeah, thank you, everyone. It's great to see so many people here, and thank you for the panelists. So I will pass over to Ramzi from the Carers Trust to take us through the first presentation. As Tim has said, we will be discussing the presentation in the afternoon from 12 o'clock in the carers-led workshops. And this presentation also talks about an opportunity for carers to engage in consultation over the white paper, so on health and care. So welcome, Ramzi. Please go ahead.
Thank you very much. I'm just going to share my screen. Hopefully it will go better than it did in the practice run. Can people see my emails? Right, are people able to see the presentation? Great. Firstly, thank you very much to Carer Support Centre Bristol and South Glos for inviting me. Thank you to Tim and Susie for allowing me to be here. My name's Ramzi. I work for an organisation called Carers Trust. And as Tim said, we're a national organisation, and we work to try and improve services and recognition of carers through what we call local network partners, so through local carer support organisations across the UK. We've got 123 network partners in the UK, covering around 70% of local authorities. So we've got some really good coverage. I'm squeezing in quite a lot to my 10-15 minutes today. I'll be touching on some research that Carers Trust carried out for adult carers, asking them what they want from social care and social care reforms. I'll also be overviewing some research we did with young adult carers of their experiences during the pandemic, and I'll be overviewing the health and care white paper that's quickly becoming a bill and will have a real impact on how health and care services are being delivered locally. Yeah, so that's Carers Trust. The policy team, which I'm part of, we influence national stakeholders and work with them very closely to ensure the voice of carers by network partners is heard, as well as the voice of services that are there to support carers. So a few hours a week to call my own is the title of the report that we did, looking at asking adult carers what support they got from social care, and what support they'd like from social care. It wasn't about the pandemic, but it was carried out during the pandemic, so undoubtedly that did impact the results. But it wasn't actually about the pandemic itself. It's about social care and social care reform. We got a great response. Over 2,000 unpaid carers completed the survey, and we were really pleased with that and really grateful for the time that they took to complete it. So as a policy person, I'm just going to throw out lots of stats at you, but hopefully it will give an insight into social care from the perspective of unpaid carers and where it's lacking at the moment, and where social care can do more and needs to do more. So in our survey, only 12% of carers said that they received enough support. That's obviously really concerning, and something that must be addressed in social care reform that happens. So as I said before, whilst this wasn't about the pandemic, it did occur. The survey did occur during the pandemic, and we found that the time spent by carers caring increased dramatically, and that was for a number of reasons. So services for the people with care and support needs had to stop, which meant that carers were picking up a lot of that extra responsibility. Again, operations within healthcare stopped. So whether that was a procedure for the carer themselves as a patient, or a procedure for the person they care for that stopped. So again, putting extra pressure on unpaid carers. The lockdown impacted on disabled people's ability to live independently, and many were potentially shielding as sort of clinically vulnerable. So again, just adding more and more pressure onto carers. And a lot of people actually became carers as a result of the pandemic, whether that's because of long COVID or because of previous conditions which are exacerbated by lockdowns and things like that. You can see here quite how much extra care carers were providing. We compared it to the 2011 census, and that found, 63% of carers, so the majority of carers were caring for between 1 and 19 hours. But now that's basically totally flipped. So now we found that 64% of carers are spending over 50 hours a week caring. That obviously will increase the impact that we know caring has on people's mental and physical health, their ability to balance work and caring.
Sorry, I'm really sorry, Ramzi, but we can't see the slides. It's just still stuck on the first slide.
Oh, sorry. I
don't know if Danny's going to help you with that.
Try sharing it again. There you go.
What about now?
Yep, that's better.
Brilliant. So this is the slide I was talking about. I wasn't making all that up. So as you can see, that and we know that there is a direct link between the hours of caring spent caring and to the impact on people's health. The three messages that emerged from carers is that they'd like better support financially. They'd like better support for the person they care for, and that they want better recognition for themselves as unpaid carers. I don't think that will come as any surprise to anyone, but those were clearly the three sort of biggest themes. Based on what carers told us, Carers Trust developed 4 recommendations. We want the government to bring in social care reform as soon as practically possible, and that should consider the needs of unpaid carers and meet the needs of unpaid carers. We want the system to move away from annual settlements for local authorities. We don't think that works for local authorities. Doesn't work for planning in the medium term or the longer term. Social care reform was actually a fundamental promise within the Tory party manifesto, so we want them to live up to that promise. And in England, funding reform must run alongside an extension of the Carers Action Plan, which was brought in between 2018 and 2020 as a sort of substitute for the promised carers strategy. But it did work well. There were some really good points in there, and we want that extended. Just want to leave some quotes up there. I think quotes from carers are always really powerful, and these really stood out to me. I'll pick one at random because of time. Support for carers who are looking after family members is important. It's incredibly stressful, and you, the government, need to do better. And I think that pretty much sums it up. My future, my feelings, my family. That was our young carers survey. And that had 961 responses, which again is really good considering, we were surveying people aged between 12 and 25. They're busy with school, work, college, wherever it might be. So we were really pleased with that. I'll start at the end this time round. What really became clear from that survey is that young carers and young adult carers want support for their emotional well-being and mental health. They want breaks and respite from caring. They want specialist services that understand their needs. They want to care overall, but they do want that to be balanced so they can fulfill their potential in education and employment. Like any young person and any person really, they want to stay connected to their friends, and they want to eat well and be physically fit. So again, I'll sort of overview these quite quickly. Again, there was a large increase in the number of hours being spent caring. With 10% of young carers and 20% of young adult carers said the amount of time they spent caring increased by more than 30 hours a week. 8% of young carers and 15% of young carers were caring for over 90 hours a week from our survey, which is, just incredible, considering, the toll that must have on anyone, let alone someone so young. Again, just some sort of stats about how it's impacted them. So young carers and young adult carers were more stressed, their mental health was getting worse. A lot of them said that they were being overwhelmed by the pressures during the pandemic. I am pleased to say that they did say that the support they did get from young carer services, was really positive, and they really appreciated that and found it really valuable. Again, just some quick quotes. Sorry, I'll just pick one out again that really sort of struck me. I'm at home 24/7, other than to walk the dog, which is the only time I get away from my caring role. I used to be able to do breaks on the weekend, visit friends or places. But I can't now. My mental health is suffering. Some days it doesn't seem worth getting up, as each day is the same. Now, whilst we all face that, every day is the same sort of feeling. I think that obviously for young carers, that was exacerbated. And the final stop on my whistle stop tour is the Health and Care White Paper. So in February 2021, the HSC, the Department of Health and Social Care, released proposal for reforming how healthcare is delivered locally. It aimed to increase partnership working, reduce bureaucracy, enhance public confidence, and there were some additional proposals around social care, public health, and quality and safety. What it's not is the long-awaited and promised social care reform. It is not proposals for increased long-term funding for social care. These are promised this year. I've been working at Carers Trust for 5 years, and they've been promised every year for those 5 years, and probably before that. But yeah, these are not the social care reforms that are promised. They are changes to the way health and care work locally. Just quickly, they move away from the competitive model that was brought in the 2012 reforms. Instead, they promote a new model of collaboration, which hopefully will develop joined up services. So the legislation gives more power, essentially, and more freedom to local systems about how they implement and deliver health and social care. On the other hand, it does give the Secretary of State more power over NHS England and other arm's length bodies. If you come to my focus group, I will get into more detail about this. I think I am sort of running out of time, and I know we've got other speakers who've got some really interesting things to say, but broadly speaking, the white paper creates some new bodies locally that will be in charge of commissioning and delivering services, health and care, well, mainly health services. And again, they move away from from competition as an organisational principle of NHS clinical care. Most importantly for social care, I just want to sort of highlight this quickly. They give the CQC, the Care Quality Commission, the power to assess how local authorities are doing in meeting their legal duties. Carers Trust welcome this to an extent, but we strongly believe that it has to come with proper social care funding, because as we've seen with the Care Act, you can have a really good piece of legislation that local authorities are not given the funding to implement it. They're not going to fulfill their potential. So whilst we welcome the duty in principle, we know that there needs to be proper funding for social care and for local authorities to enable them to do what they can and to do what they should. So just quickly, yeah, if you come to my breakout room, we'll cover what you want to see in the health and care white paper, how unpaid carers want to be involved, and locally and nationally, and what would good integration look like to you as unpaid carers. So thank you very much. And yeah, hope to see some of you in the breakout room later.
Okay, thank you very much, Ramzi. I think that was a really interesting presentation, and I hope it's giving you all a sense of the big picture. And so when we do our work, when we think about what carers need and suggestions, it's really important to bear in mind what the big picture is, what the legislation is kind of constraining or enabling us to get carers what they need. And so if anybody's interested in this, if you want to raise any questions, we'll be having a Q&A question and answer session at the end of all the presentations. So please put your question, either type it in the Q&A section or in the chat section, or you can just raise your hand later on when we get to it. And so now pass over to our next speaker, which is Sonia Davies from Bristol City Council, and she'll be talking about a survey on all the carers during the pandemic. Thank you, Sonia.
Thank you. Thanks very much. And if you give me a second, I will share my screen so that you can see my presentation. So yes, thank you. Are you looking after someone else? This is a survey that I commissioned from Bristol Older People's Forum. So my name's Sonia Davis, and as Tim introduced me earlier, I'm a strategic commissioning manager in adult social care. And we've spent the last 15 months really trying to work in new ways, work collaboratively with people, but also identify where the key sticking points are, not just in terms of responding to the pandemic on a day-to-day basis, which we've had to do across social care over the last 15 months or so alongside our NHS colleagues, but also think about, so what happens next? Where are we going from here? And what are the real issues? So are you looking after someone else is the title of a survey that we commissioned from Bristol Older People's Forum to look into some of the issues here. Some of the context to this survey and the reason for coming up with it was partly, and this is taken directly from the survey report itself, there are millions of new unpaid carers across the country. The Carers UK estimate 9.1 million moving to 13.6 million during the pandemic. But also in terms of older people, at least a quarter of all carers are over 65. This is nationally with estimate around 400,000 over 80. That's really quite shocking that people who are of that age are expected to care. And one of the things that we wanted to do, particularly in Bristol, the people here today, and thank you very much for coming, with all respect to you, we know who you are. You are engaged with services. We know you're already here, you're talking to Carer Support Centre, you're involved, you identify yourself as a carer. The real thing we were trying to do was reach people who don't even realise they are carers and find hidden carers. Just to give you some very headline statistics, our latest estimate in Bristol is that there are around 48,000 people who are carers in some shape or form in Bristol. We know, and that's through the council, through the support centre, through NHS services, we reckon around about 17,000 of those. That's really quite a big gap in the number of carers that we don't know about, that aren't identified to us. And really the point of this survey was to try and identify really what's the scale of the number of hidden carers, what are their issues, and how can we try and support them so that we can start to build services going forward for Bristol specifically, but working with our neighbours in South Gloucestershire and North Somerset as well around how we can actually tackle some of the issues. I can tell you now there won't be any surprises within this report about what we found, but it's really helpful for us to have tangible statistics from this. So the survey was sent online and also in paper format to around about 2,500 people who were Bristol Older People Forum members. So it's a light touch report. It wasn't about trying to capture every single hidden carer in Bristol, but it was a sample that we wanted to give us an indication. And it was done during January and February of this year, which was incidentally during another lockdown period, which creates its own additional stresses. And it focused on 4 sections about who people are looking after, what the carer's own circumstances are, what kind of care they provided, but also an opportunity for their own views in an open format. We had 133 responses, which, given the pressure that carers are under, I'm actually really impressed with. I think that's a really good response rate, which also says to me really highly that people want to be heard. People are feeling that they need to say something about this, which I think is both terrifying but great, that they're willing to shout about their needs. There's some statistics there. One in particular that I want to pull out is that 42% of respondents, and these are carers themselves, also had a long-standing illness or disability. So these are people who are ill themselves, whether it's a well-managed condition or otherwise, who are also carers. And I think that's quite a shocking statistic. More than a third of the respondents, and I am running through just the headlines, the full report is available and we can circulate that, that's no problem. But more than a third of respondents had no help from anyone else. And I'm not talking about formal care services, I'm talking about having any other family members to help out or anything, they're doing it on their own. 35% were providing full-time care, that's 24/7, and 31% were providing daily care. And half of those who are getting no help have been doing this for more than 10 years, and a quarter of them for more than 4 years, with a quarter of them for more than 10 years. And that's really quite scary, because those people have been carers for a very long time with no help at all. We need to do something about that, quite obviously, but it's quite telling actually having these as statistics. 56% of carers had their own health conditions, and that included things like diabetes, asthma, as well as sort of full disabilities and other conditions. 69% have never had any assistance or support. Now, the nuances in this one from the previous one, this is about people who've never ever come forward for a carer's assessment, who've never accessed formal support services, who've never contacted the carer support centre or ever made any request for help through any of the support agencies that are available in Bristol. 63% of the people who responded care every single day. And even more shocking is 40% of those doing full-time care, that's 24/7 care, are over 75 in age. And that's really quite a scary number, because those people are aging themselves and have their own conditions. The types of care, I'm sure for most of you looking at this now, you'll recognise all of these things. And just to say, I'm a carer myself, so I do also recognise all of these. There aren't any surprises in this list for me. It's a lot of it is practical support and just helping out with house and shopping chores and general life admin, as well as this full personal care as well. But it's those small bits and pieces that really consume time and effort and energy that are the bulk of what people are doing. So these are some very big headlines. There's an awful lot of text and narrative behind this in the full survey report. But the real challenges that came out of this was about people feeling that they were losing their own identity. Quotes such as, "I'm only a carer now, I'm not a wife anymore." And I don't feel, I've lost my entire social network myself. I am only a carer. I get no time away from it. I live and breathe caring. That's all I do. That's quite scary. Time, and again, this isn't just about the amount of hours people spend on caring, but the time in the day to do anything else that they want to do. And the fact that there is no release from the time pressure. They're dictated by the timescales of the person they're caring for, often, particularly if they have medical needs and things, they're administering medication. There's a time link there that is really critical. And bearing in mind, this is focused on carers who are aged 55 plus. So this is quite an intensive amount of pressure for those people. The emotional pressure and sense of responsibility that people have, and the mental health and well-being of the carer themselves is a really key thing that came out. People are feeling, particularly during lockdown, and this was during the lockdown in January, February that this was done, that sense of absolute pressure and not being able to get away. There was a real sense of isolation for carers, particularly during lockdowns, when they couldn't access support, they couldn't see friends and family, but also the person they're caring for couldn't see their social networks either. There was another really key comment that came through in several times, is where the person they were caring for felt utterly hopeless and despairing about the situation during the pandemic, and the carer was trying to manage their despair and despondency as well as their own. And that definitely, that word of being trapped was a key thing that came out. Lack of support, and that's not just about formal support, that's also about support from family, support from other friends, etc. Some of that was practicalities due to the pandemic, but that was there. And finances, Ramzi mentioned that as well. Financial support was a really key thing that came out. There were a lot of comments about the level of benefits available to carers, and the fact that carers allowance stops when you retire was a key thing that came out as well. So there was an awful lot of comment around that. That's not something in our gift in Bristol we can respond to, but actually nationally that's something that needs to be looked at. What would help? We've focused on solutions as well. Someone who talks to, someone to talk to who just understands. It doesn't have to be professional services. People aren't looking for formal support here. They're looking for just a person to talk to who understands. Peer support from other carers, someone that they can link with, but they don't necessarily know who they are. Access to professional specialist support when it's needed. Quite often that's medical based. But things like, I've got an issue with this person's medication, I don't know who to call to find out. It's not just my GP, it's really specialist support. I can't get through to the hospitals because they're absolutely unavailable at the moment in the middle of the pandemic. Who do I call if I need help with something, if something's going wrong with the person who I'm caring for? A real need for practical support, just things like someone to do my gardening for me and weed the garden so it's not a mess will make me feel better. That someone to do my ironing for me would make all the difference. It's things, the little things that would make the difference. And respite and time off, we know, we hear from carers in Bristol a lot about the need for appropriate respite. Some of that has been challenging because things have been closed during the pandemic. That's not helpful. But also it wasn't even just about formal residential respite provision. It was about, I just need a half hour away from this, otherwise I'm going to explode and fall over. I need a way of doing that. I need access to that. So that was a thing that would be really helpful. There were some amazing positives in this as well. We got an awful lot of really good feedback. People loved the fact that as a carer, they have company, so they're not isolated themselves. They've had closer relationships with family members. Sometimes caring breaks down some historic issues that you may have with family members. We've all had different issues and relationships with parents and excuse me, children and so on. Sometimes caring really does break that down. Excuse me. Having a sense of purpose as well. Caring gives people a sense of responsibility, sense of purpose that gives them a reason to keep going. And in some cases, during the pandemic, excuse me, during the pandemic, it's given people a focus and a reason to get up in the morning and to carry on themselves because they've had someone else there to cope, to support. People have developed their own knowledge and skills as well as through being a carer, and they valued that. One thing that really struck me was that sense of duty, where people have said, I'm now caring for my parent and I'm repaying all the care they gave me when I was younger. And actually, I really appreciate that. And I feel that there's a duty there, but it's a valued duty. And also the thing about the confidence in the quality of the care that the cared for person is receiving was a real key thing. So here are some recommendations that were in the report. Again, this is very headline and you can have the report itself. It's publicly available. This is what we need to look at. This is what the Bristol Older People's Forum analysis came out with. We need to think about mental health for carers. We need to make sure that the services that are available really reflect the changing needs and demographic profiles of our older population, but all carers as well. That respite needs to be regular and ad hoc and emergency. We need to think about longer term impact planning, particularly with minimising crisis. Let's be totally honest, the people answering this survey are older, and ultimately we need to find a way of having those really difficult conversations about when the carers themselves or the people they're caring for reach the end of their lives. How do we put things in place so that they don't have the stress of worrying about what happens next? We need to have some of those very difficult, challenging conversations. And believe me, as a carer myself, I know how difficult those are, but I also know the peace of mind that having had put things in place, and knowing things are in place, that peace of mind can be there. It's really helpful. And also, ultimately, it's about information for carers, bearing in mind this was targeted at people who aren't going to be here today, who don't even recognise themselves as carers. We need the information for people, not necessarily with the badge carer attached either. That's why we titled this, Are You Looking After Someone? We need that information to be available and accessible to everyone, including how to get financial benefits, how to maximise the support that they could get, what is available to them. That is the end of my presentation, but that's and I have to apologise to the group. Unfortunately, I'm not able to stay for your Q&A session afterwards, but the colleagues here, and including particularly Tim and others Carer Support Centre colleagues, are definitely working with me on how we take these recommendations forward in practice, and so please do, and they will feed back to me any queries or comments that you may have on this. So thank you.
Muted. Thank you very much, Sonia. That was a really interesting presentation, and I think to me it brought to light how we need to do more to engage carers out there that perhaps don't even identify as carers. And I think if every carer in the room would speak to all their friends that are carers and put the word out, there's a care support centre, that would help. But also obviously more systematic work. Also the question seems from that, and from what Ramzi also said, that carers have been through the pandemic had no respite at all, and they're desperate for respite. So for me, the key question would be thinking around what our carers going to need in terms of respite moving back to normal. It feels like carers are desperate for at least a weekend break. So respite of that kind is something we need to think about. So again, if you have any questions for Sonia, we'll answer them later in the put them in a Q&A section or the chat section, or raise your hand later. I can see the number of participants has gone up, which is really great. And I now pass over to Emma Temple from Bristol City, from South Gloucestershire Council, which is going to talk to us about their survey that they've done on carers during the pandemic. Thank you, Emma.
Good morning, everyone. It's nice to be here. Thank you, Ramzi and Sonia. Your presentations were really interesting. I almost forgot that I've got to speak because I was getting so into them. I'll just share my screen a moment. Okay, so I'm Emma Temple. I am the Commissioning Officer for Carers at South Gloucestershire Council. Thank you for having me. So I'm here to talk to you about the survey that we conducted earlier in the year. I think some of the results are going to be really similar to what Ramzi and Sonia have been talking about, so they're probably not going to be too surprising, but obviously this is from a South Gloucestershire perspective, and this is all adults as well. So just a little bit of background about the survey. So it took place between the 4th of January and the 1st of March, and we had 227 responses, which I thought was quite good. The purpose was to seek opinions from carers about the increased pressures due to COVID, and we want to gather as much information as possible on how to adapt the services going forwards to better suit your needs. So I am just going to go through key findings. There was so much that came out of this. I won't go through every response, but I'll just go through the main headlines that really stood out. There was also the opportunity to add additional comments, and some of those were really insightful. So I'll go through some of those too. So the questions surrounding caring role and responsibilities. So 64% said that their caring role has changed as a consequence of the pandemic. Nearly half of respondents said that they are caring for more hours, and 31% said that they are providing different types of care. 5% said that they are now caring for more people. So obviously as Sonia said, we project that this number is a lot higher. This is just of the people that we were able to reach and that responded to the survey. So some of the comments that were at the end of this section. So it can be stressful looking after a loved one, trying to protect them from the virus. So I think not only have carers got, their day-to-day caring role, all the pressures of homeschooling, working from home that have been added to all the balls that they're trying to juggle, then there's also this headspace that's taken up with just trying to protect someone from this scary virus that nobody really knew anything about at the time. So I've been more concerned about the well-being of my sister, who experiences profound mental health difficulties. I'm the only person who has been in her flat in 10 months. So again, just worrying about the isolation, not only that you face as a carer, but the person you're caring for, and the headspace and the stress that comes with that. Care and support for more hours and different because of closure of community activities for adult daughter. So having to find things for them to do, just making sure that their well-being is still up together and they're doing all the things that they used to do, but trying to do that from home. So with my COPD, I find it difficult to lift my partner from her wheelchair into the car. So this has made getting her out of the house difficult. So perhaps carers, your roles have been more physical, where perhaps you would have got help with that in the past, but couldn't because of carers not being able to come into the home or shielding, things like that. So I care for my father and husband, both at the same address as me. My father used to have an active social life, and now I feel he can no longer be independent because of COVID, and I have to take a greater role in his well-being. So again, switching maybe more to a bit of more of a mental health care role, and making sure that the person you're caring for is getting all the well-rounded activities that they're used to get. So sticking with health and well-being, so 81% of respondents said that the change in caring role have impacted on their health and well-being. So that's a massive amount. There's also been a big drop in how carers say they look after themselves. So South Glos do these surveys regularly, every 2 years usually. And before the pandemic, 63% said they looked after themselves. So that's dropped by 20% now to 43%. And nearly a third say they feel they're neglecting themselves. So nearly 40% say that the pandemic has, to some extent, had a negative impact on their finances. So not just because obvious of being furloughed and things like that. In some of the comments, people mentioned that obviously being at home more, their bills have gone through the roof. If they've been homeschooling and working from home, printing costs, things like that, and buying things, activities and things for the person they care for to do at home because those services aren't available. 77% said they have not accessed a break since the start of the pandemic, and that is likely to even more be the case if you live with the person that you care for. So that is a huge amount, and although it's not surprising, it's still very powerful, and it's such a shame reading that statistic out loud. So over half of carers said that self-isolating would be difficult due to their caring responsibilities. Bit more of a positive. So 9 out of 10 said that they were aware of the free flu vaccination and would be prepared to have it. And that was a similar number when we asked about the coronavirus vaccine as well. So some of the comments, we had obviously a lot of comments, so many comments about this. I've just picked up some that I just think highlight the situation. So have seen GP about low mood and depression. I need time when I can just not be looking after my husband, even for an hour. So you're not asking for a week away or anything like that, just a short break, as others have said, just half an hour to do something that is not caring. I really don't know where to start, feel totally lost, just muddling along. The lack of respite care of any description has been the major problem and continues to be so. No idea how care would be provided if I took a break. Add working full-time and homeschooling situation is unmanageable. So yeah, just the pressures that a lot of us have faced during the pandemic have just been exaggerated because of the caring role. I can't even leave the house now to go for my daily exercise. Absolutely shattered, as are friends who are also carers and have had absolutely no respite. At times I feel I cannot provide care. So I think, yeah, it makes for some somber reading, and it's just this overwhelming feeling of exhaustion, low mood, anxiety, a lot of that stemming from not being able to have a break. So a few comments about the services and support that's been available. So 39% said that they have found it easy to find information. Comparatively, that was at 48% before the pandemic. So I think that a lot of this could be because, you know, people used to get that information from peers at support groups, or when they went to visit a centre for something else, perhaps they would bring up that, you know, they need a little bit of help with this benefit or something. And although some offices have been open, it's not always been easy to access those, and or for that person to get online and access that information online. But 68% said that they are able to use equipment such as computers, laptops and mobile phones confidently. So we had a little bit of a mixed response when we asked, you know, what you would think of online services continuing. And as Tim said, you know, it has been a benefit to some people, and some of these comments do illustrate that though. But there was some negativity. So I don't like virtual Zoom type support. Somebody checking in by phone is helpful. I'm not a fan of online services, so I can't see what sort of break it would give me. I would prefer to get away from a screen. Somebody suggested craft sessions by Zoom. Art courses by Zoom and online, and a list of activities for over 70s with memory problems. This person accessed journeys over the internet, so they went to Barcelona via the internet, and they think that the internet's been great for that sort of thing. If there was some sort of virtual support sessions for my mum, it would give me half an hour or so of freedom for a walk or to phone a friend. So that's one suggestion going forward. Obviously, that would depend on the needs of the cared for person. So this sort of thing could vary, but you know, if that is a possibility and you can sort of let them do an activity online, it could give a bit of a break. I think this comment sums it up, and I think we can all relate. So I am all zoomed out. I just want to meet my friends in person now. So just a little bit of other things that have been going on in social care in general. So not just what our little strand has been focusing on, but pretty much the whole of the council have just had to focus on its COVID response for the last 12 to 15 months, and it has dominated our workload quite a lot. So obviously some teams more than others, but it does mean that some work's been put on hold, and we'll be playing catch up with that. It's been a bit of a balancing act between making sure that we're all following the government guidance, but also that we're meeting our statutory duties. Obviously, day centres have been closed, care homes have had visiting restrictions. Just on a side note to that, we are working with day centres now to, I think some of them have already opened with a combination of face-to-face and online activities, obviously with social distancing in place. So hopefully we'll see more of that as the year goes on. So the council have been working closely with public health to ensure messages are reaching relevant groups. For example, where to get tested, how to get PPE, making sure the website's always up to date. We've been helping with the vaccination rollout. So, for example, the direct payment monitoring team have been phoning everyone with a direct payment to see if they employ a personal assistant and whether that personal assistant would like a vaccination. We've obviously had the knock-on effect from the pressures that the NHS have been facing, with obviously like operations being cancelled and things like that. So I think we'll be playing catch up for a little while, but hopefully we're heading in the right direction. So what are the positives? So as Sonia said in her survey, not everything was negative. Some people indicated that they were coping or that nothing had even changed. Others said that they were still able to work as they had an understanding employer. And I think just personally, that is the positive that everyone can take away. I think employers have had to be more flexible. A lot of people have been working from home, so not having that commute has given them a little bit more of a home life and work balance. Some carers have enjoyed the switch to digital services and groups. There's no commuting, no need to get somebody to look after the person you care for. Gives more flexibility. You know, if a carer lives in like a rural part of South Glos, they might have to take a bus journey for 2 hours just to go to a 1 hour support session. So hopefully it means that these services have had a greater outreach because they can reach people that probably wouldn't have joined in before. So there's been the opportunity for some people to learn how to use these services better. So perhaps if a carer wasn't very tech savvy before, they fully embraced Zoom and Teams and Facebook so that they're enabled to reach that community. And I think just in general, there has been a greater sense of community, and I really hope this continues into the future. So just in the little area I live in, there's a Facebook group, and you can post on there if you need some shopping doing, if you're shielding or self-isolating, and there's more sense of be kind, you know, the be kind hashtag that's seen everywhere. And I really hope that we can use that and run with it, and that it doesn't gradually die down. So how are we moving forward? What are we going to do about this? So we have already discussed these findings at the Carers Advisory Partnership, which is a meeting that we have every quarter with carer reps and partners that we work with, such as the NHS and the Carer Support Centre. They're all aware of these findings, and they can then use them in their decision making. And the same goes for our colleagues in commissioning as well. We're just about to refresh our carer strategy. We've already kicked it off a little bit, but we will be using these results to write into our action points and planning going forward. And we want to use this feedback to make positive changes. We're retraining our practitioners on carers assessments. So our social workers and occupational therapists have all been asked to go on this training so that they can be reminded on how to do an effective carers assessment, remind them of what services are available, and the reopening of short breaks and day centres. We've made the council's wellbeing courses available to carers for free. So these are the courses that we're invited on as staff. They are all online. Most of them are quite short sessions, so it shouldn't take too much time out of your day. And it's hopefully something that you'll be able to benefit from. There's a little bit of like mindfulness on there, and just things like that that hopefully can be practical and you can use it in your day-to-day life. So to summarise, I promise I'll stop talking now. So there has been an overwhelming feeling of exhaustion, anxiety and low mood. That's been clear from the comments in the survey. A lot of that stemming because we just haven't had a break for over a year now, probably. Although there is a clear desire for face-to-face services to resume for both the carer and the person they care for, there are concerns surrounding keeping your loved ones safe from the virus. And so again, like I said, it is that balancing act, and trying to balance mental health with keeping your loved ones safe from coronavirus. There is still some demand for online to continue, and some people have really embraced the changes. And I just wanted to say that South Gloucestershire Council recognise the important role that you play within social care. We really value your time and your effort that you put into caring for your loved ones, and it is important that we take this feedback and use it to make positive changes for you in the future. Thank you.
Okay, thank you so much, Emma. That was also really interesting to see how issues around, again, problem around managing work and paid jobs with care. And just one question I think we need to be aware of is, to what extent is the pandemic got people, carers have to give up their jobs. We know from there's a lot of evidence that a lot of mothers gave up their job because they couldn't cope with looking after children as well as doing the paid work. And it would seem to me that although we don't have any stats, as far as I know, this is an issue that might have impacted on carers as well. So that'd be something useful to think about. So again, please put your questions in the chat and Q&A. And we got our Judith tell us all about work with hospitals and everything else. So here you go, Judy.
Thank you. I'll just share my screen. Right. So hopefully everybody can see that all right. So my name's Judy Ganlock. I work for the Carer Support Centre, and I work in the health team, which is both in hospitals and in GP surgeries, and my role is training and development. But I'm going to talk mainly about what's been happening in the hospitals. I can't get my line. Oh, there we go. So we work across sites. So we work at Southmead Hospital, so MBT. We also work for, we work in, oops, I'm having a problem with my slide. Let's see if that's going to go. I don't want to move. I don't know whether you can help me, Dennis.
Try the arrow keys.
Yeah, I'm trying, but it's just not. Oh, there we are. Yeah, seems to be working now. Sorry about that.
Excellent.
Yeah, so we work at Southmead Hospital, and we also work in the central Bristol hospitals. So we work at the Eye Hospital, the BRI, the Oncology Centre, and the Heart Institute. We're planning to develop a bit within the Children's Hospital. We did used to work at South Bristol Community Hospital, but that's now been taken over by Serona, but we might do a little bit of work there in the future. We're a small team, all part-time, and so my role is training and development, but my other lovely colleagues, so we've got Tracy and Red and Sam, and we've got another Judy Porter, who joined us this week. They receive referrals for carers. So you can refer directly to us as a carer if you or the person that you look after goes into hospital. But most of our referrals come from hospital staff, and the sort of support that we provide is a lot of emotional support, but we can also provide advice, information, signposting, and we also liaise between carers and hospital staff. And my work is developing our service and also providing training to NHS staff. So what I thought I would do is talk about some of the main issues that have arisen from carers, what my colleagues have seen from their work with carers over the last year. And I really felt I needed to should have put emotional distress at the centre in terms of hospital admissions. I've been a carer myself, and I know, and this was pre-pandemic, I know I found a hospital admission for my father extremely stressful. And I think if you add COVID into the mix, it creates a sort of new dilemma and new level of stress. And my colleagues have said that it's been the most demanding work that they've done in their years of supporting carers. I think that emotional distress for carers has been linked to a number of different things. So we've seen with visiting, certainly during the first lockdown, people really weren't able to go into the hospital to visit. We've had changes in the visiting arrangements. So now they're allowing one nominated visitor per patient for the duration of the stay for an hour, but also added on to that, exceptions can be made for a carer if the patient needs them for personal, physical and emotional care and support whilst in hospital. So there is that recognition of carers, but I think the visiting restrictions have been very difficult. And also because of COVID, not all carers have wanted to go into the hospital. Numbers are low of COVID now in the hospital. The hospitals are very busy at the moment. But understandably, going into hospital whilst we had the lockdowns and when COVID was at its height has been very scary for carers, and carers have also been worried about the people that they look after in hospital catching COVID as well. So that's been a great concern. One of the other issues has been around contact, and contact has been difficult with patients during COVID. And at the time when you weren't able to go in and visit somebody, sometimes getting through to a ward was difficult. And certainly what we found is that the wards during the height of the pandemic were reconfigured. So sometimes it was difficult to make contact with people. Sometimes people that we had contact with, they've moved around and were working in different areas of the hospital. So that has also been an issue. I put feeding there. That has been an issue because pre the pandemic, the hospitals rely quite a lot on volunteers to help with feeding of patients, particularly patients with cognitive issues. And with the pandemic, volunteers haven't been going into the hospital. There has been an increasing demand upon staff. And I know that carers have expressed concern about patients losing weight. That is something that we've raised. We've raised it at a very senior level, and a high-level report has gone through within MBT about this. One of the other issues I would say has been delays. That's not new. I think we've seen delays within the hospital pre the pandemic, but with the pandemic, what's happened is the social workers have moved out of the hospital. So if a patient needs a social work assessment, patients are going to nursing homes. So there've been a number of beds bought by the health authorities, and there's a shortage in a number of those beds. So that's led to patients being in hospital for a bit longer. So those were sort of general themes. The other thing that we've done is we've developed an online evaluation form. We've also got a paper form for people who can't access this online. We've really just started this, but I think the responses that we've had have been really interesting. And the language that I've used on this might seem a bit strange, but this language mirrors the Carers Charter, and this is a document which both trusts have signed up to, and it talks about promoting a culture of supporting and working in partnership with carers within hospitals. So this language that I've used here is mirrored in the Charter. So the positive is that 85% of carers said that they felt respected, listened to and understood during the hospital journey. But 71% of carers from our survey said they didn't feel included in all discussions on all aspects of care during the discharge process. So that's something that, as a service we want to address. We want carers' views to be taken into account during the discharge process, because carers bring a wealth of information, and also we want additional strain being placed upon carers. So what are we doing to address some of the issues that I've talked about? I think the first thing that I would say is about providing feedback. We attend carers strategy meetings within the hospital, and there's a number of other meetings that we feed into. So we feedback regularly what information we've heard, what information we've received. We provide case studies. Yesterday we met informally with the carers lead at UHBW, and I fed back our latest results from our evaluation. I think feedback is both positive and negative, and we make sure we feedback things that have gone well. So as I said, most of our referrals for carers come from hospital staff, mainly from the therapy teams. And every quarter we look at our statistics and we recognise those that have referred the most carers to us for support, and we give them a certificate, and we call these people carers champions, because really we couldn't do our work supporting carers without staff identifying carers. Training is a big thing that we do, so we've developed an online training, an e-learning package on carer awareness with staff at MBT. I've also delivered training online to medical students, postgrad nurses. I'm about to deliver some training at the eye hospital. Also, one of our young adult carers has been involved in a customer care training video, and this has been great. I've not actually seen it yet, it's not been released yet, but I've been told as a training tool, there's so much in it that will promote conversation, challenge assumptions. So staff hearing firsthand from carers makes such a difference. It makes them think, it makes them reevaluate their practice, and it makes them think carer. Providing staff with information is important. So obviously we have things like posters, leaflets, I also do a monthly newsletter to NHS staff. I'm always interested in ideas for that. So if you've got ideas around what information that I could include to staff that's important to you as a carer, I'd love to hear. The other thing that I've done is develop a carer-friendly hospital award. We have an award scheme already for GP surgeries. There's interest in piloting this at the Eye Hospital. I've had some input from our young carers about what they think is important in a hospital. I've also been talking to other carers organisations in Wiltshire and Devon, and they've got similar award schemes. So that's been really valuable, but that's something I really want to progress. The other thing is we've been working remotely, so we are going to be returning to work in the hospitals. And I think that's going to change things, and that's going to help us in terms of developing hospitals being carer-friendly places for all. So carers say a lot of nice things about our service, which is great, but I always think there's more that we can do. So I'd love to hear from you about things that we could be doing to improve our service. I also just wanted to mention 3 different things that you could become involved in. One is next week on Thursday, the 17th of June, between 10 and 2. And you can find out more about these by joining my breakout room. But next Thursday, NHS England has got a virtual workshop on GP out-of-hours services, and they're keen to hear from carers what they think about these changes. If you're a carer and you're working within the NHS, there are a number of seminars which are being put on. These are online by the Royal Society for Medicine. So again, if you're interested in these, and some of this is looking at carer-friendly hospitals, carer-friendly GP practices, and also the NHS having a carer-friendly workforce, then please come to the breakout room, and I can tell you more about that. And finally, at University Hospitals Bristol and Western, so the BRI, the Central Bristol Hospitals, they're looking for 2 people who care for people with learning disabilities, and they'd like them to join their Trust Learning Disability Steering Group, and that meets 4 or 5 times a year online. So again, if that's something of interest to you, please join the breakout room and talk to me about it. I can pass your details on, and Susie can also provide additional support. So thank you very much.
Okay, thank you so much, Judy. Can you all hear me? Yeah. So yes, as Judy said, there's various opportunities to get involved at national level with NHS England. This is an opportunity coming from the Carers Trust. So if you want to join that, let us know. Ramzi, our first presenter, will be supporting you in that work. The other work is more local, and get in touch with me or Judy. Join the breakout room later on. So and tell people it's so important to have your voice heard and your experiences there. So we finished with all of the presentations now. Thank you everyone for listening. I hope you found them interesting. And now it's time for questions and answer. So the way to do this is that you can either type your question in the chat box or in the Q&A box, or you can simply raise your hand. And I'll be if you want to read the question yourselves, you can, or you can actually just put them in the chat. So the first question we have, and don't be shy, any question is a good question. It's always good for presenters to get questions. It makes you feel that what you said was interesting. Otherwise you think, oh, nobody asked me questions. So go ahead, please. Any question would be great. So the first question I have is from Manda Mako, and she's asking a question for Ramzi from the Carers Trust. And the question is, Will the Carer Trust have a role in lobbying central government regarding the long-awaited social care and proposals for increased social care funding for carers? Or joining with the carers organization, with other care organizations that do this? Amanda Maple is from Bristol City Council, commissioning manager. So this is a question for Ramzi.
Hello, thank you, Amanda, for that question. The short answer is yes, definitely. As an aside, I was doing some file management yesterday, and I found a folder called the Green Paper, which was what they promised around 3 years ago. So it is something that's definitely on Carers Trust's radar. It's central to the policy team's work plan for this year. So Carers Trust will be doing it as an organisation through and with our network partners, the local carer support organisations I mentioned earlier, and through the network partners with the carers that they support. Because, you know, I can write a consultation response, I can meet with decision makers, but actually I need to know what to say, and it's network partners and carers who are going to tell me what to say. You know, our what we're going to be calling for is obviously, more money, more support for carers, and it will be, we'll be advocating for things like respite. The other thing that carers tell us, and again, this won't surprise anyone on the call, is that carers want better support for the person they care for. So there's two aspects of it. There's support for carers, 100%, yes, but also better support for the person they care for, because actually, if the person they care for gets support, that puts, that obviously relieves a lot of pressure on unpaid carers. So as well as Carers Trust as a entity with network partners and carers-based support, we're in a few coalitions that we'll be working with to lobby government for increased support for social care and carers within that. So we're part of something called the Care and Support Alliance, and that's around 80 national organisations, people like Age UK, Carers UK, MS Society, so quite big national charities, and we've come together to essentially do exactly that, lobby the government for better social care for people with care and support needs and their carers of all ages. So that's definitely something we'll do. On a less sort of campaignsy route, we're also part of something called the Health and Wellbeing Alliance, and that's a partnership between again, national charities and what we call system partners, so national government departments, people like the Department of Health and Social Care, NHS England, and we're there to be a bit of a critical friend, to have an early say on what they're thinking around policies such as health and social care. So yeah, to answer your question, absolutely, we'll be reaching out to network partners to try and get them involved in shaping our response. Now, what we rely on is government timelines, which are unpredictable. So I can't tell you now, by June we'll be doing, it's already June, isn't it? By July we'll be doing this, by August we'll be doing this, because at the moment we don't have a clear timeline from government. As soon as we do, we'll obviously be coming out to network partners and to carers and working through the coalitions to make sure social care is properly funded, and within that, the needs of unpaid carers are central.
Okay, thank you, Ramzi. I think Sue Cohen raised her hand. Dennis, can she speak, or?
It was raised, but then it was put down again. So.
Is she able to speak technically, Dennis?
Yep, one sec.
Okay. Hi, Sue. Do you want to ask a question?
Hi. I lowered my hand, but I just wanted to say how powerful the responses were from the surveys and how informative that is. And because I'm part of Women's Commission in Bristol, and it's those responses from the carers that actually motivate people to really fight for change. So thank you for that.
Thank you, Sue. Thank you for coming. Okay, do we have any more questions? Anyone? Any of the panelists want to ask some questions?
I'd just like to say something really, I think, Susie, a couple of things. I mean, first in response to Susie, that you know, the last contributor, I think carer stories and those sort of case studies they're like gold dust when you're trying to either influence change or selfishly when we're trying to look out for funding opportunities with fundraising trusts, etc. And what they really do is show the actual impact of your work, you know, because we can throw lots of information out about how many of this we do and what we do with this, that, and the other. But actually, a carer articulating the impact it's had, hopefully positive, on their life or on the life of the person they care for, you know, that there really is nothing more powerful than that. So, you know, if carers ever want to put their stories together and sort of share them with us, then we'd be absolutely delighted, because as I said, it can be used in all sorts of contexts. Also, I think with what Ramzi was saying earlier on about the national consultations, etc., that's one of the, I think, added benefits that we have as a carer support centre, as being part of a national network. So we're wholly independent, and we work solely for the people of Bristol and South Gloucestershire. But what it does do in a two-way method is it gives us the opportunity to take the feedback that you give us locally around Bristol, which is probably replicated in all other parts of the country. But it gives us the opportunity to pull that together and give that as more ammunition to people like Ramzi to be going to government. And when you combine that through all the sort of centres around the whole of the country, then obviously you get a bit more scale to it, which I'm not going to be naive and say it will definitely result in change, but I think you have far more chance of changing things when you can demonstrate that it's actually something that's felt by so many different people. And the other thing we benefit from, obviously, is you know, we do a lot of work, and Judy mentioned about the liaison we do with other carer centres on the hospital work, and we get lots of support around best practice and not always reinventing the wheel. So I think it's a really positive partnership. But you know, don't think that what you give us that sort of might be to do with national policy gets lost, because we do use that and send that up to Carers Trust, and it can be really, really useful.
Okay, thank you, Tim. Anyone else want to make some comments, questions? I think we have Heather. Yeah, Heather Dunley. Hello, Heather. Do you want to say what your question is, please?
Yeah, morning. Thank you. It was to do with Judy, with what she was asking for the BRI and Western hospitals about 2 people with the learning difficulties. It's more information on that I was interested in. I didn't catch it all, unfortunately. You're muted. Oops.
I'm muted. Can you hear me now? Oh.
Yeah.
That's it. Finally, I've got technology to work.
Keep your hands off the keyboard now.
Yeah. Let me just. So this information came from Tony, Tony Watkins, who we work with very closely at University Hospitals Bristol and Western. He's the public and participation worker, and he said he wants. He coordinates a trust learning disability steering group, and that meets 4 or 5 times a year online, and they would like 2 people who are carers for people with learning disabilities. And what they want is carers to offer 2 things: an additional external assurance that the trust is focusing on the right things, and they also want to hear carers' own perspectives on what really matters to people. So that's a bit more information about that. There might be other opportunities coming up within the trust for people to become involved. And one thing that he mentioned was patient safety, but he said that's not defined as yet. Certainly, I think at MBT, there may also be opportunities to become involved in care strategy groups, dementia groups. So, you know, and we're always looking for people who want to become involved. And I'd also, I think, echo the point that Tim made about real life stories. You know, I can't underestimate how much of a difference that those make to staff. One of the young carers about a year ago gave me a case study about her experience in hospital. And I've gone on about this, but I've used it so many times in training, and it has made such a difference, particularly in training medical students who are similar age to the young carer. It just, the look on their faces and the understanding that that case study and somebody's own words made was such a difference. So I don't know if that question was for me about becoming involved. So I think the thing is to come along to my breakout group. I feel like I'm doing a bit of an ad, but you know, come along. I can take your details. Susie and I can support you, and we can also put you in touch with the right people to get you involved and get your voices heard within the hospital.
Okay, thank you, Judy. I have another question. I know, Ramzi, you got your hand up, but I'm just gonna read the question. Amanda, do you want to read your question, or do you want me to read it? Amanda, can you hear us? All right, I will read it out. Yeah, do you want to read out your question?
Yeah, sorry, I couldn't, I was trying to find the unmute. Yeah, so I'm caring for my husband. Initially started caring for him when he became visually impaired, but he's now just at the start of a dementia diagnosis journey. And if there is anything I can do and be involved in, you know, I'd like to be able to put something into the system.
Yeah, I mean, yeah, I think that would be great if there are, yeah, and certainly we could take your details, you know, and pass it on to relevant people within the trust.
That would be really, yeah, really good. I mean, we were in the hospital last week, and obviously I'm dipping in and out today around being caring. But yeah, the carers charter, that was a little bit ropey as to how that was applied. So
yeah.
And it was interesting because the nurse was in charge of making the decision, but the doctor said he wanted me to be there. And you're in this kind of grey area where you know that you've got rights as a carer, but you don't also want to upset people. So yeah, I'd really like to, if there's anything I can do just to make things smoother for anybody else, I'd be really keen to do that.
That is fantastic.
That would be brilliant, Amanda.
Yeah, I agree. And my job is also to kind of support carers that want to get involved in this kind of work and to have a voice. So I will get in touch with you. And are you a member of the Carer Support Centre?
I'm well, yeah. I don't know what you would call a member, but yeah, I use them quite a lot. I was on the South Glos one that Luke did yesterday. So
fantastic. So I'll be in touch very soon, and that would be really, really great.
Fantastic. Thank you.
Yeah, thank you.
Thank you.
So the next question is from Ramzi. Ramzi.
Thank you. I mean, if no one else wants to come in, it's not so much of a question as a comment. Just to echo what Tim was saying actually about sort of carer voice and the importance that holds, both by national organisations like Carers Trust and national decision makers. So as you all know, this week is Carers Week. On Monday, we enabled 2 carers to attend a virtual parliamentary event where they met, I think it was 5 MPs in the end, and they had sort of, you know, a good 20 minutes with those MPs just talking about their experiences. Yesterday, there were 2 other sort of lower key events where, again, 2 carers were there talking directly to decision makers. So, yeah, a couple of things that sort of stand out. couple of years ago, I think, where I was talking to an MP, and what they said was social care isn't a post-bag issue. So what she was basically saying was, you know, not enough people write to MPs about their experience of social care. Now, my retort to that was, well, carers are too busy caring to have the time to write to MPs, which, you know, they did take that on board, but it does show the importance of highlighting to MPs what you're going through as carers, because the more they hear from carers, the more they will understand what big issue it is. And in terms of the impact that you know, work between Carers Trust and network partners has, again, when I first joined Carers Trust, I actually worked with Carer Support Bristol and South Glos and a few other network partners on identification and support of carers within GP services. And we produced sort of a nice little good practice document and talk to sort of national decision makers. And one thing led to another, and basically what resulted, partly because of NHS England priorities as well, but there you go, what resulted was a GP quality marker, which is released to all GPs in England, and they can use that to show how they're supporting carers. We didn't quite make it into sort of statutory land, but it's a really useful tool to show GPs really easy steps they can do to identify and support carers. And then we also got them to agree that they could use it in their CQC inspections. So when the Care Quality Commission come in and start poking around and start asking questions, the GPs can say, we're following this quality marker and this is how we're supporting the carers. So it really does make a difference on a local level as well as a national level. So I know carers are really busy, but if you've got the time, we really appreciate your feedback and your involvement, because it really does make a difference.
Thank you, Ramzi. I would echo that big time. And also to say that another thing that we're here for, and it's kind of my job, it's to support carers who want to go speak to their MPs so we can organize local MPs surgeries. And we have MPs who are very connected to the Care Support Centre already, and we've done work with them before, so they're very interested in hearing what you have to say. So if you're interested in that kind of thing, please get in touch with me. And all you need to do is just ring the care centres and they will pass you on to me or send me an email. So I've got a couple of questions. I've got another question here from, is it S. Anson, all I can read? Do you want me to read it or do you want to speak about it? Sorry, I can't see your first name. It reads, I'll read it. Okay, so we had a very bad experience in Children's Hospital. Discharge covered up what had gone wrong, and Children's says this is were not nasty to me. I needed an advocate to help put our experience to the community team and make sure there was help instead of nastiness and colleagues cover up. A really miserable experience. I've lost faith in all of them. Making complaints just led to retribution. Anyone want to come back on that?
Yeah, I mean, it sounds like an awful experience that you had. Yeah, I can empathise, but also say that, yeah, it's really hard making complaints. But I think unless we make complaints, nothing is going to change. But I really get for you, it sounds like that was a really difficult experience. And also to it's putting your head above the parapet, isn't it, in terms of making a complaint. Yeah, I mean, I think we are going to do some work with the Children's Hospital, and we're a small team, but what I want to do is improve our service, improve understanding about what we offer within the Children's Hospital. So I'd hope that could improve the experience that carers have within the Children's Hospital.
Okay. So, yes, also want to say that, you know, it does sound like a really, really difficult experience, and that often happens when people make complaint, as Judy said. It also happens sometimes with just people raise their voices in whatever scenario it is, to show that they're angry and they're not prepared to put up with injustice, which is this what it is. So well done for doing it, and I'm really sorry it wasn't pleasant, but as Judy said, we need people like you with the courage to complain, and do let us know if this sort of thing happen again. We need to know in the care centre so we can support you to make sure it doesn't happen. So and also now, so is there any more questions or any comments, anything, or otherwise I can take us through our next session? Yeah, so the next, so we saw today, you know, we saw the outline of work and having presentations on a number of issues, and then so that in presentation can inform our thinking around all the questions and issues that have been raised around the pandemic and carers and what supports carers are going to need in the transition into a sort of normal. And so after this, we will be grouping again into breakout rooms. Unfortunately, for technical reasons, we won't be able to use the same Zoom link. So we need to ask everybody to join us in the breakout rooms in about 15 minutes by using the other link that has been sent to you by email. Maybe Dennis, can you put it in the chat now as well, please, Dennis, so everybody can see it?
Yep. And there's another email going out at 11:45 as well. So
Okay,
check your
so
inbox and also check your spam junk mailbox as well if you don't see it. So, but I'll post it in the chat now, meeting ID and passcode.
yeah, so what I wanted to say was I would tell you a little bit about these sessions. So you there's going to be 3 breakout rooms. One breakout rooms is going to be facilitated by Emma Temple, who presented about the South Gloucester survey, and it's really about the question in that room is, what support do you need to readjust as we begin to come out of the pandemic? So it's a chance for carers to join the discussion and think about, my God, if, you know, once things start up again, which could be from next week or a bit later, what kind of support do I really desperately need now? Yeah, because of what I had to endure for 1.5 years. So it'd be really important to hear your voices and and what you think. The breakout round 2 will focus on the presentation on the work that Judy and her team do related to Judy's presentation around the hospitals. So experiences around the hospital during the pandemic, and also in general, I think Judy wants to talk about the, you know, what would make a carer experience of taking somebody that they care for to hospital be pleasant, so that that can inform our work with hospitals. And then the final room is breakout room 3. Is going to be facilitated by Ramzi from the Carers Trust, and this is going to be about the local the national picture and the white paper and the care strategy. And Ramzi also wants to talk to carers who want to get involved in national work in terms of having their voice heard in national work, as some of the example he gave you before. So there are some opportunities coming up. So please, if that's what you're interested in doing, please join that breakout room. I can also support you in that work alongside with Ramzi. The other thing I wanted to say is, don't forget that we're going to have a prize draw, that your emails will be entered in a prize draw. And hopefully 4 of you, not hopefully, but 4 of you will be the lucky winners. and you will find out about that in July. So it's now 11:40. Tim, you want to say
Susie, can I
something?
say just very quickly? I know there's a real temptation when there's a short break in a session like this, which is needed because we've all been sat down for quite a while and we just need to stretch our legs a little bit. So it's important we have it, but there's a real temptation to then not come back. So please do come back, because I think what's really important, and I think especially for the local aspects of this, your feedback and the information we get from these discussion groups is really timely, because currently we've got Bristol City Council going through a consultation on their all-age carers strategy, and that will have a direct impact on the sorts and levels of services that they commission under the new contracts whenever they come out, which could happen at any time. And so there's a real opportunity to influence the kinds of services that you think would be useful for carers that maybe are commissioned and paid for by the local authority now. So it's really good timing for that. South Gloucestershire, as Emma mentioned earlier on, are also going through a review of their carers strategy. So again, there's a real opportunity to influence. And locally, very selfishly for me, as I said at the beginning, at Carer Support Centre, we are undertaking an organisational review. And again, feedback on services and how things would work for people would be really, really useful. So I know quite often you're asked for your views and you wonder wherever they go to. I think you will have 3 really receptive audiences, and I'm sure Ramzi as well, in terms of the feedback that he can take back to sort of complement his national consultation. So it's a plea from me really to say, please do come back. Thank you.
Yeah, and I'll second that, and all the panelists, I'm sure as well. Really looking forward to listen to what you have to say, because we know in the presentation section, there isn't much opportunity for that. So this is your chance. So Dennis, can the breakout rooms, are they due to start at 12, yeah?
Yep, that's right.
Okay, so we'll see you all in 15 minutes. Grab a coffee, whatever, and some food, and looking forward to see you very, very soon. Thank you very much.